I work at, in SUPHR at the health department. My title's Harm Reduction Research Coordinator. I've been with the health department for about 3 years. And prior to that, I've done a lot of like community-based harm reduction work. So today I'm gonna just kind of go over how to use fentanyl test strips with you all. It's a pretty like quick and easy training. But you know, if you have any questions, feel free to just put them in the chat, or honestly, you can just interrupt me. That's fine too. But yeah, I'll just get it started. So fentanyl test strips is kind of using them as a tool for overdose prevention. Fentanyl test strips were decriminalized here in Philly in August 2021. They used to kind of be considered paraphernalia. I don't know if anyone was ever actually like charged with drug paraphernalia for them, but it was a possibility. They are actually now fully legal in the state of Pennsylvania. There was a bill passed late last year, and it just went into effect this year. And there are kind of more of those bills happening across the country. So just kind of like some background about fentanyl and the dope supply, which kind of more what we call like our heroin supply now. And that's partly because there isn't very much heroin here anymore in Philadelphia. Since about 2017, we've really seen fentanyl kind of take over the dope supply. If you aren't familiar, fentanyl is a synthetic opioid, which is, you know, different from heroin, which is plant-based, comes from like the poppy plant, whereas fentanyl can like be made in a lab, and it's significantly more potent than heroin. And there are like over 100 different analogs of fentanyl as well. That vary in potency. They can be, you know, about as strong as heroin or anywhere up to like 100 times stronger. And just analog is kind of just like a term for, you know, like they're very like chemically similar, but it's usually like one little bit of them is like slightly different, which, you know, makes them often contributes to them being different strengths. Here in this picture, these are examples of some counterfeit pills that have been pressed with fentanyl. A couple of those are like from the DEA, and some of those are pills that were actually seized here in Philadelphia. And then this last part here is just kind of about tranq dope, or also known as xylazine, which you may have heard more about recently, but it's been increasingly common in our dope supply as well. All that just to kind of say that like the drug supply is kind of like changing all of the time. And, you know, even if, you know, someone buys from the same person regularly, or, you know, uses kind of like, this, you know, thinks that they know what they're using, it's often very difficult for people to actually know. So kind of with that is also an immense amount of variability in the drug supply here in Philadelphia. This is a part of testing that we've done at the health department in partnership with NMS Labs, or CFSRE. And in that time, we've seen, this is an example here of just one stamp that we collected of dope, and just kind of how you can see how in such a short period of time, within like 2 months, that bag changed on a regular basis. So, you know, like if someone is using, even from the same person, the same bag all the time, it does change, you know, can change day to day, week to week, what's in there. So if someone has like a particular tolerance for fentanyl, you know, they might be able to use that bag and feel normally perfectly fine. But then like the next day it could be twice as strong, or have like twice as much xylazine in it, and could put people, you know, at significant risk for overdose, or just generally kind of not the effects that they're looking for. And also, you know, this is here just also to kind of show that, you know, a lot of the overdose crisis now is really framed in terms of being about fentanyl, and fentanyl being like a very, there's a lot of like scare tactics around fentanyl, and it's definitely like a very potent drug. And if you don't have any tolerance for it, it can be very dangerous. But at the same time, a lot of people, particularly people who are regularly using opioids in Philadelphia, will often do have a tolerance for fentanyl. And so it's less scary in that regard, but really a lot of the danger comes from how quickly and regularly the drug supply does change. And so we've also seen a number of instances of fentanyl contamination. So there was a few instances here in Philly where K2 was contaminated with fentanyl. So instance of cocaine fentanyl contamination among some service workers who unfortunately passed away here in Philly. And so again, these are drugs that people aren't expecting fentanyl to be in. They usually often don't have any tolerance. So that's kind of, again, why it can be so risky, because without any tolerance, you're highly susceptible to experiencing an overdose, since fentanyl is so strong in such a small amount. And that kind of just points to the importance that, we talk about, Narcan, overdose prevention, and in this case, like especially fentanyl test strips with people who use all types of drugs. Fentanyl test strips are originally, this is kind of what they look like, the packaging that they come in, originally were purposed for, and are still used for urine drug screens to see if people have recently used fentanyl. But they have been repurposed as this kind of harm reduction tool for checking your drugs. And unfortunately at this point here in Philadelphia, they're not super useful for a lot of people who are using dope, just because it's so prevalent in the supply. But I would say they're like super useful tools for people who are using other types of drugs, where fentanyl contamination could happen. And just some, ideas of, we say like fentanyl contamination, because sometimes people will say that drugs are like laced with fentanyl, or that people are like intentionally putting fentanyl in other drugs. And, I don't think we haven't ever really found any evidence of it being intentional. It's just that like a white powder, often there's no way to differentiate like a white powder from another white powder, just by eye usually. So if someone is, packaging drugs or cutting up drugs or something, maybe on a scale or on a surface, and they aren't like fully wiping surfaces down, or, maybe just a little bit got mixed in with something else. That's kind of like what we mean when I say like fentanyl contamination. It's the idea of like, it's an accident, basically. It wouldn't make much sense for people to be like intentionally lacing like other types of drugs with fentanyl. We don't, if you look at it from like an economic standpoint, like that would be like trying to kill your customers, and that doesn't make very much sense. So this is 2020 data. Our 2021 data was just released recently, so this is slightly out of date, but it's more just here to kind of show that both like polysubstance use is real, so people are often using multiple substances. And while it here says, like one stimulant and fentanyl were present at the time of death, we have no way really knowing what drugs people use. This is just kind of based on toxicology data. So what's in someone's body at the time of death. So unfortunately from this data, we really can't tell, like was someone using like cocaine and dope or opioids, or was someone used a substance that was contaminated with fentanyl. We really can't tell from our overdose data, but you can see also from these maps that all demographics and all regions of the city are impacted by overdoses from multiple types of substances. And again, this one is just resident locations of fatal overdoses. And that's, again, also to kind of just show that it affects all neighborhoods and demographics. I think sometimes there's a perception that in a certain neighborhood, if people are overdosing there, that that person is not from that neighborhood, and it's people from different neighborhoods coming there to use drugs. And that certainly does happen some, but I would, it's also important to note that it does happen in every neighborhood, and like those people are your neighbors, and do live in every zip code of Philadelphia. This is a health alert that we put out in 2020, trying to increase awareness of counterfeit prescription pills. A lot of pills that people buy on the street are pressed with fentanyl. There are definitely some people who know this and are intentionally seeking out those pills with fentanyl. And then there are other people who may not be aware, don't have any tolerance for fentanyl, and so again are very high risk for overdosing. And also, like sometimes if people are from out of town and they come to Philly, or if they're experimenting, those are the instances that we think about as, people who are also very high at risk and would also maybe be less able to kind of tell a counterfeit pill from a like real pharmaceutical grade pill. They do look very similar, so it is very hard to tell, but some are done better than others. So enter fentanyl test strips. They are a tool that we see as being able to help people make informed choices about their substance use. So this is kind of just a list of what you would need to use fentanyl test strips. You would need your drug of choice, whatever that is. Again, currently, we do not recommend them for meth or MDMA, unfortunately, just because there is a concern for false positives. So, a false positive would be you were to test the substance and it would come out saying that it was positive for fentanyl when in fact it actually wasn't. So like a false positive in that scenario is definitely better than a false negative. But that is just like a weakness of the of the strips. I mean, we kind of like officially cannot recommend them for that purpose, but I also do know that some people still use them. Because it is more of like false positives are the risk, people still feel comfortable using them, but that's kind of like a personal choice that people make. And then you'll need one fentanyl test strip, any like fresh or sterile water. You can use like bottled water, tap water, and then you just need like a small container of some type. So it could be a bottle cap, a cooker, a spoon, or I mean, you could still like use a cup, but you just want it to be essentially small enough that you have room to kind of like dip the strip into liquid. So just real fast also, like fentanyl test strips, before I kind of go into the demonstration, basically what they are able to tell you is if it detects in the sample that you test, whether or not fentanyl is present or absent. And unfortunately, it can't tell you though, like anything about how much fentanyl is in your substance. So it just is able to tell you whether the part that you tested, whether or not it actually detected fentanyl in it. The strips have some analogs that they aren't able to test for. We haven't seen really that any of the ones that it can't test for are here in Philadelphia. So they are, still pretty useful and accurate for the way our drug supply is here in Philadelphia. And I also, just to kind of say, like I said, kind of they can tell you whether fentanyl is present or absent in the sample that you tested. And I say that just because, there's no like 100% guarantee that any, substance is like safe to use or has no risk of any sort of like overdose. But also, if you are testing a substance, kind of known as like the chocolate chip cookie effect. So like, let's say you have, a chocolate chip cookie and there are chocolate chips in some parts of the cookie and not others. So you could take a bite that, maybe doesn't have any chocolate chips in it. And it's the same thing with any drug sample, unless you're testing actually all of the drug, there could be, perhaps fentanyl in the part that you tested and not the other part, or maybe in, not in the part, the small amount that you tested and in like the rest of the bag or something like that. So, like the ideal way would be to dissolve all of the substance you have in water and then test that. And then like in theory, someone could then drink that and still, be able to use their substance. But that's not like going to be a way that most people are willing to test their substances. People are looking for a certain effect. And if you dilute it in water and drink it, you would definitely have like a less powerful or intense effect than the other ways that people might go about using, like snorting or smoking or injecting a drug. So since most people are not going to dissolve the full drug, we recommend that you just use like a very small amount. The strips are super sensitive, so you could even use something like drug residue. For example, if someone is using like powder cocaine, we would usually like recommend that someone kind of like take the bag and shake it all around, and then either like transfer it to another bag or pour it out onto whatever surface you're going to be using from. And then you could even just use like the residue of the drug inside that bag. And that's kind of like a good way to try and get like a more accurate amount of like the sample, because it's kind of like a little bit of all of it in there, as opposed to like if you're just taking like one little scoop of the drug and testing that. But if for whatever reason, someone didn't have like another container to transfer into, you still can just take like a little scoop of the drug. You don't need very much at all. It's about like the amount of like the size of like a match tip or like the tip of like a pencil point. It's like a very small amount, which is good because that hopefully will, help people feel better about using fentanyl test strips because they don't have to like waste a lot of their substance. So here we just kind of have on the screen like some step-by-step instructions, and I'll kind of show you with like an ibuprofen in a second. But again, so you would want to add about, here it says like a 1/4 inch of fresh water to residue in a cooker, water bottle, cap, or spoon. 1/4 inch is just kind of like an easy eyeball for some people, but it's about a teaspoon or 5 milliliters of water. You want to be careful to not use too much water because it is possible if you like over diluted the substance, then you might have a hard time detecting the fentanyl. But like I said, the strips are very sensitive, like they're meant to be used for like urine drug screens. So you would have to probably either add a lot of water or there would have to be like very, very little fentanyl present. But good rule of thumb is to use about a teaspoon of water. So I showed you, this is kind of like what the strips look like in their packaging. Inside each one is like one test strip. It's good for one use. And this is what it looks like when you take it out. This solid blue line is like kind of where you want to hold the test strip from. And then these wavy lines right here are the part that you want to put into the substance. So I'm going to I'm going to stop sharing for a second just so I can show you kind of like a demonstration of how you would do it. So again, we kind of like have our test strip here. I'm just going to lay it on here. This is just like a little bottle that I have of water, and it has like a little cap on it. You can use like a soda bottle cap. I'm just going to put it right here. And so like I explained, kind of if someone was using powder cocaine, that you'd want to use like the residue in the bag. If you have like a pill, Ideally, like again, you'd want to dissolve the whole pill in water. People are not likely to do that. So what we do recommend is if you have a pill, like this, what you would like to do is you want to kind of like crack the pill in half. And that's because you want to try and take from like the middle of the pill, the sample that you're going to use just to try and kind of get the best amount of it. So what I normally do is I just like kind of will rub it together like this. There's like a small amount that's going to fall into your, bottle cap or whatever. It's kind of hard to see, but as you can see, like it's a very small amount. You don't need very much at all. If someone had some other type of pill that they wanted to test that maybe had like a coating on it, or like maybe if they were having a really hard time breaking it, you would want to essentially like, you could use like a key or anything kind of like sharp or whatever, even like probably like a pen to kind of like scratch some of it off. But you would just want to encourage someone to make sure that they scratch under the coating, like to get beyond the coating of the pill for testing it. So I have like my water here, and I'm just going to pour it into this bottle cap. This holds about like 1 teaspoon of water. So it's here in this. And then you're going to take the test strip, holding it from like this solid blue end. And you can use the test strip to kind of like stir it around a little bit, just to kind of like make sure it's all mixed in and dissolved. And then you're going to put the test strip in the water with the wavy lines going down. And then you just want to be careful. There's like a solid blue line. Get it a little bit closer, like that solid blue line right below those arrows. You don't want to go past that solid blue line in the water just because it could make the test invalid. So you put it in there and you want to leave it in there for 15 seconds. I'm not going to leave it in there for 15 seconds right now, just because I know this is an ibuprofen and the test is going to be negative, but you'd want to leave it for 15 seconds. And you'll know that it's kind of like working because water will start to rise up. If you can kind of see here that it's like a little bit wider at the top, that's like the water kind of like rising up from the bottom. And you're already starting to get some red lines on it. So what you want to do is then just kind of lay it flat and wait at least 15 seconds, but usually if you wait up to a whole minute, that kind of will let you get the kind of like full effect of the test strip. It's very similar to like how, a COVID test works. At this point, we've probably all done that. It's like the same technology. So probably not that difficult for people to use at this point. So then, possible results, you could get a positive result, a negative result, or an invalid result. So it's the opposite of like a pregnancy test, opposite of your COVID test. So it's that part can be confusing. But if it is one line closest to the blue end, that's like the control line. That means it is positive for fentanyl, and if there's 2 lines, there's no fentanyl. So as you can see, like this one that we just did, it has 2 red lines. That second one, closest to like the wavy end, is pretty faint. But as long as you can see the line, it is negative. Some invalid results that you could possibly get is, especially if you went above that solid blue line, is that, it could just be, you could see like no lines or maybe just like red smears. That would be an example of an invalid result and a time when you would want to get a new test strip and try it again. The other ones right here are an example of 2 negative test strips. I like to remember it like 2 lines, like the word no has 2 letters. So like no fentanyl is kind of how I remember it. And again, then the 1 line closest to the fully blue end is positive. There's also just kind of like a graphic down here of another invalid result that you could potentially get, where if you saw just 1 red line closest to the wavy end. And again, that's when you'd want to get another strip and try it again. The test strips do have expiration dates, and they haven't been validated to work past that expiration date. So like this is kind of like the back of the strip. It kind of says like this one expires in May 2023. So at that point, I wouldn't want to use these anymore, because we don't really know if they are able to do what they're supposed to at that point. Also on the back, like if you carry these around, if you ever forget, they also have kind of the lines in terms of positive and negative. It doesn't orient you to like which end is which is, so it can be a little confusing. But the idea is kind of like the way, like all the test strips should be in there with like this blue end at the top where like you tear, that's like, it tells you to tear right there too. So if you like lay it up and line it up that way, that's the correct orientation with the way that it tells you on the back to remember what the results mean. So just kind of, again, like safer use. So, fentanyl test strips are just one tool. They can only tell you about fentanyl or other fentanyl analogs. And again, like the chocolate chip cookie effect I mentioned, it's possible that fentanyl still could be present in your substance, even if the test is negative, because it could be like in a part that you didn't test. And so you still definitely want to use caution. You want to try to use a tiny bit of your substance first, just to make sure that it has, the effect that you're expecting. You always want to have Narcan on hand just in case. Trying to use around others or people that you trust. People who hopefully, maybe you feel comfortable telling that you used something, just so that they can respond and help if anything were to happen, or if you became unresponsive. People, if you're like maybe like partying and you're in a group, I would encourage people, like use test strips. And then, even if you get a negative test result, I always recommend people like stagger use. So if you're like a group of 4 people, kind of have, one person use first, wait, like a few minutes, 5-10 minutes before like another person uses, and just so that way, if anything unexpected happened, there are people, who haven't used yet who can respond if they need to. And then, not everyone is going to feel, comfortable or safe, or, it might not even be viable considering, how much someone might be using, to always be using around other people. So in those instances, we also try to encourage folks to use like remote supervision resources. So examples of those are like the Never Use Alone hotline, which is a hotline that someone can call and let them know, like that they're using, and basically someone stays on the phone with them, just to kind of like make sure that they're okay. And then in the event, if someone did become unresponsive, the Never Use Alone hotline will call 911 to respond. There's some other examples too, but there's also like the Be Safe or Brave community app. They have has a couple different names, but if you look up either one of those names, you should be able to find it usually. And again, that's an app based. So you could do a phone call, but you can also just do like texting. And that resource is made like by people who use drugs, for people who use drugs very specifically. People are allowed to kind of create their own safety plans in the event that they become unresponsive or possibly overdosing. So, some people may not feel safe or comfortable calling paramedics or emergency medical services. So this app allows people to kind of like create their own plan and say like, if I become unresponsive, I want you to call my mom or something, or, my mom is here, so call my mom and she can respond. And then just in terms of getting fentanyl test strips, here in Philly, you're able to get them from Prevention Point for free. You can also use a resource called Next Distro, and that's in partnership with the local harm reduction group here called SOUL. And basically you can just go to nextdistro.org/Philly, and they will mail free Narcan and fentanyl test strips to you, like directly to whatever address you provide. It's free. They don't really collect any private information other than like the address that they need to mail to. And no one can tell what's in the packaging or anything like that. And then dancesafe.org also sells fentanyl test strips. They actually, though, just recently started making their own like brand of fentanyl test strips, and kind of as we're seeing like the demand for fentanyl test strips increase, there are many more companies kind of creating and marketing these test strips to people for specifically like harm reduction purposes. So just like the training that I went over is like, it's kind of these ones in this green packaging. The company is called BTNX, and those are just the ones we use because those are the first ones that were like validated in a scientific peer-reviewed study to be known to be able to like confidently detect fentanyl compared to like the technology that they use in a lab. But they are making more and more of these strips. So DanceSafe also sells fentanyl test strips, but they are a different brand now than these green ones. So, you can purchase, they do sell them there, so you can purchase them. I think it's like, it comes out to like around 75 cents a strip, which is also can be like pretty costly if someone is like using pretty regularly. But if you were ever to kind of want to use their strips or buy them from them, I would just recommend you kind of pay attention to their instructions and follow those more closely. Their instructions are definitely a little more complicated than the ones that we provide, but can be like a more accessible tool for people sometimes. They are allegedly supposed to be better at being used with like stimulants like meth or MDMA, and have less of that issue with like that false positives like we talked about. So, if some of that is like someone's, substance of choice, that, in that case, those might be a better strip for someone to use. And yeah, that's pretty much the end of it. Does anybody like have any questions or need me to kind of like repeat anything?
Thanks, Rachel, so much for that. I'm looking in the chat and it doesn't look like there are any questions, just a lot of praise for your presentation. Everyone seemed to enjoy it. So thank you again for, being here with us this evening. I love having you. And, hopefully, if you guys continue to like this content, let me know and I'll be more than happy to reach out to Rachel, or her contact information is right there. You can contact her too. And, maybe we'll see if we can set up another training like this or similar to this in the future. All right. I'll hang out if anybody has any pertinent questions, but other than that, again, thank you, Rachel. And I'll post this up on our Philadelphia MRC YouTube page, also post it on LinkedIn. I'll send a recording to Rachel so that she has it as well. And all of you will get a recording email to you as well. So don't worry about that. Okay. Thank you. Enjoy the rest of your evening. And thank you for being a Philadelphia MRC volunteer. Thanks, Rachel, again.
Yeah, you're welcome. Have a great night, everybody. Go Birds.
Right? Go Birds. Good night.
Bye.